for this webinar. Just a couple of quick housekeeping notes before we get started. You can drop questions in the chat, and we of course want to address issues as they come up and questions as they come up, but we'll also have time at the end of the webinar where you can ask questions and get more detailed responses. Clay Sides will be leading us off here, and at this point I will transition it over to him.
Great. Good afternoon, everybody. Really appreciate everyone getting on the call. This is often a topic that's usually met with a lot of hesitation because people don't usually necessarily want to talk about HIPAA and all things compliance. But what we wanted to do is have a brief conversation to talk about what you can do to really not just go beyond HIPAA, but advance your current organization's standing and how you approach HIPAA compliance and certification. Let me ask the simple question of everybody. Everyone's going to ask this: why? Why would I do this? Right? Some of the objections we hear: our organization uses an MSP, so we're already secure enough. Our organizational resources are already stretched too thin to take on any new initiative. And we all know it, we're dealing with finite resources. Or maybe I'm just only required to meet HIPAA, so why would I do more? Why would I open myself up to someone being able to find things that I'm doing wrong when they're things that I may not necessarily be legally obligated to do? Fair questions. But before we get going, I wanted to introduce some of the people we have on the phone from our side. Obviously myself, Senior Technical Principal for CloudWave, have been with the organization now about 12, almost 13 years. And I'll let Johnathan go ahead and introduce himself.
Hello, everyone. Johnathan Buice, Director of Advisory Services and Platform Operations, former CIO in a hospital with 20 years in a rural hospital setting. Lead the advisory services here at CloudWave, doing some of the cyber consulting and working with remediation, and also doing risk assessments, assisting in doing risk assessments as well.
Very much, sir. And lastly, but not least, we're very happy to have one of our brand new colleagues, gentleman by the name of John DiMaggio. John, can you go ahead and say a little about yourself?
Absolutely. Well, happy to be here. John DiMaggio, Managing Director of Blue Orange Compliance CloudWave Company. My background is Chief Information Officer in healthcare. Co-founded Blue Orange about 12 years ago. Started helping hospitals meet the new HIPAA regulations when they were new, and have since been helping all types of healthcare organizations comply with HIPAA and improve their security. So very happy to be a CloudWave company and to be here today.
Great. Thank you very much. So let me jump right into it. So I could go ahead and drop in amazing million infographics or benchmarking statistics, but in the reality, the thing you need to understand the most is if you aren't working to improve your security, then you're likely the next target. It's that simple. There are plenty of metrics and plenty of informatics that actually talk about what the trends are in the industry and what things are looking like. And we'll touch on a little of that as we go through some of these discussions here. But again, this is the ugly truth. We're all hearing about compromises. We're all hearing about how some of our colleagues are suffering through some of these things. So we need to do our due diligence. And if someone can design a perfect system, I'd love to hear from them because they're going to be the next richest person on the planet. In the meantime, the best we can do is really the best we can do. But seriously, why? Why should we do these things? HIPAA's focus is really around protecting PHI. It provides guidelines on administrative safeguards, physical safeguards, technical safeguards, and organizational safeguards. It's really an operational guide to better all cyber hygiene, really, just keeping track of your data. What HIPAA doesn't do, it doesn't provide a way to get you there. It doesn't provide a way to improve. It just tells you the things that need to be done. It doesn't provide you guidelines to help you implement what needs to be done, right? It really focuses on the individual pieces. We're jumping ahead here. Talks mainly about the PHI rather than the integrity of all systems. We really need to worry about the integrity of all systems because not just our data affects patient health, but all of the systems we use around the periphery, the IT, the OT systems. And again, it doesn't provide clear standards which result in auditing inconsistencies in some cases. If you bring in two different auditing companies, chances are the majority of what you find or what you get written is going to be the same, but it's not going to be 100% consistent. That's really something that I think we can do a better job on by going and applying some additional standards or frameworks. What are we talking about here? We're not talking about massive change. We're talking about evolutions. Everyone here is already working to secure your systems. You're already working on HIPAA compliance. So what we want to do is just change the thinking based on how the world is changing around you. And the world is evolving. The threats that we're dealing with in our environments, as everybody knows, are global. We're seeing increased activity literally in ransomware-focused healthcare attacks from companies like, you're seeing them here, Black Cat, Interlock, BERT, and has anyone heard of Vanilla Tempest, another one that's very, very active? These are criminal organizations that are really solely focused on extracting money from healthcare. That's their primary charter. Why? Because it's an emotional subject. Anytime we deal with someone who is being cared for in a hospital, there's already an emotionally charged environment. When you deal with records being compromised or our inability to perhaps offer the same level of services we did before, that really starts to pull at people's heartstrings and it makes people want to react emotionally rather than logically. Sadly, as you can see, some of these organizations have begun using AI against us. AI is a new technology, not that new, but new for our world in terms of practical applications. And it really has become a game changer. The problem is it's become a game changer for the bad guys as well. And they're developing new tactics, including, as you'll see, supply chain attacks. Supply chains are a big vulnerability in our worlds. We have done so much work to try and tighten up our organizations, tighten up all of the leaks in our walls surrounding our castle, that we are a more difficult target to get to. So what do the bad people do? They actually pivot, just like you would in any business. They pivot to areas that may not necessarily have as many resources. They may not necessarily have as many people or be as sophisticated. We also have the increase of public and regulatory scrutiny. Everyone's carrying around phones, right? Mobile devices. These devices really allow for news to spread either via horrible means like social media or news feeds from different news outlets. So this is not something that people may not necessarily see. If there are folks that are tuned in or subscribed to certain types of news feeds, they'll get notifications if something has happened. It happens in their pockets in minutes. The Office of Civil Rights, or OCR settlements, we're starting to see increases in size and frequency of settlements from the OCR. I've got a table if you want to stay at the end of this presentation past the thank you slide. I actually have some of the most recent OCR settlements for our industry and just some of our peers, not necessarily some of the suppliers, but other healthcare institutions. We're also dealing with states now implementing additional privacy laws. Almost every state either has additional laws on the books or is working on them. In this particular case, I just cited one. New York State's New York Code of Regulation and Requirements actually has a section that talks about how certain specific records need to be retained up to 10 years, whereas the HIPAA standard is only 6. And it's just this one particular type of record. So these are the types of things that we need to try and be careful of when we're trying to find ways to change our compliance, because it's not just HIPAA now that we need to worry about, it's the local requirements, the state requirements as well. And everyone knows, I'll say the C word here, cyber insurance. It's very difficult. Those forms keep getting more confusing. They get harder to fill out. And as a result, what we're seeing here is it's harder to get cyber insurance, or it may just not be, you may not be able to get it at a reasonable rate. By evolving how you process your compliance, by going to a more stringent method of compliance that may be above and beyond what's actually required by the law, you actually can make it easier to get cyber insurance, and may, as one customer who cited to me specifically found out, you may actually see some discounts. Oh. Lastly, this is not something new. You're starting to get executive orders that have been coming out of the office of the president. EOs 13694 and 14144 actually came out of the Biden administration. Actually, I believe 13694 may have even come from Obama. 14306 was the most recent directive that actually came out of the office of President Trump. And this was directing NIST to strengthen the guidance, including updates for NIST 853. So if you're not familiar, NIST 853 is a compliance framework that was developed quite some time ago, and I'll touch on it in a little bit to kind of give you a little more background. But really, these are guidelines and frameworks we use to more securely manage our environments and how we actually grow. Lastly, the business and clinical impact. And because of those things in people's pockets, we now have soft costs that are much more difficult to measure, right? Events, we know the events affect patient care. There have been studies on it. Tufts University has a study that covered outcomes of patients from 2012 to 2016 and how there were increases in, quite honestly, morbidity following a cyber event. We know these things impact our patients. We know there's financial impacts to our patients as well. Apologies for mouse jumping around on me here. We know there's financial impacts to these events as well. Either going to be in the form of a ransom or, heaven forbid, in the form of some sort of lawsuit or pending litigation. Lastly, it's the reputational impact from increased public awareness as a result of those baubles in our pockets that go off every time there's a splashy news event somewhere in our area or on something that we've subscribed to. Love this particular quote. Albert Einstein, everybody probably knows, person that came out and said, the significant problems we face cannot be solved at the same level of thinking we were at when we were created them. And that, quite honestly, is what we're talking about. We need to move beyond what we're currently doing, strive to be better, strive to be more. We need to evolve how we look at ourselves, adopt a stronger, more comprehensive security framework. Some of the frameworks we talk about, C2M2. CloudWave has used the C2M2 to try and assess your cybersecurity capability and maturity. It's the C2 of the M2, cybersecurity capability and maturity model. Originally developed by the DOE to quickly assess an organization's maturity and capabilities. Really emphasizes an organization's capabilities, how they govern themselves, and how they remain resilient across the different areas or domains of this particular spec. The C2M2 really is a good first step. If you haven't done anything but HIPAA risk assessments, unless you've been fortunate enough to work with companies like Blue Orange, who actually take a slightly different approach. NIST 853, Rev 5 is another framework that we typically look at trying to evolve customers into. So if you've already done some baselining and have a framework set up, we would work to try and move you into a NIST 853 type F framework. This is actually a very, very comprehensive framework that has a full catalog of security and privacy controls. We can make it as modular as you need based on the impact and the criticality of your systems. And it's a much more mature spec than most. The spec has actually been around since initially 2005 in various iterations. Its current form is really very, very robust and very comprehensive. And even it is being updated to add some additional things based on some inputs from the executive office. NIST CSF, we kind of view NIST CSF as an enhancement or a bolt-on to NIST 853. So What we talk about here is trying to use NIST CSF to more increase the functionality and improve and expand on the functionality in 853 and try and align it with functions that may be easier for people to work with. John, do you have any color to add to that? I'm going to put John on the spot. I apologize.
Yes. You know, HIPAA is the floor, right? So you have to at least meet those regulations. And it's a very basic floor, right? So now with advanced threats, even the HIPAA floor is changing. There's proposed regulations that have you do penetration testing, more supply chain, things that are more important right now to do. So the HIPAA floor is changing, and it's not just the regulations. There's reasonableness. There are, a legal thing to pass, which is negligence. An organization like yours that has X number of health records and is a hospital, what should you be doing reasonably to take care of that, right? So there's all types of different eyes on this, and and although you can't spend all your money on security, but there's a reasonable factor, to meet those regulations, do what you can to protect the information, keep up with regulations and where the science is going for this. And nothing will prevent an incident. But if an incident does happen, you can have a much better time afterwards, because that's when really they'll be shining a light on everything that you have done or should have been done.
Yeah, and again, it's that increased public and regulatory scrutiny that we see, right? We want to avoid that. Those are, again, soft costs that are very difficult to manage, and perceptions. Want people to feel comfortable when they come into our organizations that we are at the leading edge. That's always where we're trying to align ourselves. Thank you, John. So the big question here is, how do we choose? I'd love to be able to tell you there is a silver bullet or how to go ahead and choose a specification, but the reality is it can be pretty complicated. We suggest, and I don't mean this to sound salesy, but we suggest you reach out to an expert. I'd love to be that expert. John would love to be that expert. Johnathan would love it. But at the very least, reach out to an expert to help try and evaluate what your needs are based on specific criteria. That could be your risks, the goals for your organization, your current budget, your current security posture. Maybe you are already doing many of the things we talk about. Maybe you've already started to employ a framework and want to try and figure out ways to further enhance that. Or maybe your organizational maturity. We do run into organizations where these frameworks and talk of these frameworks has been happening for quite some time, but they're not really sure how to move forward with them. And yet other organizations we walk into, they are on their 4th or 5th NIST 853 version 5, Rev 5 audit or assessment, and they're a very mature organization, and even they are wondering what the next step is. So please, if you're unsure, reach out to an expert. There can be benefits.
And one other thing with that too is assessing your risk tolerance, risk strategy, right? So it could be the board, it could be management that says, hey, first of all, we want to do what we legally need to be doing, what we should be doing, but do we want to be the most secure? Do we want to do the basics? And then build your cybersecurity program around that, right? Because unless you really dictate your risk tolerance of how secure you want to be, will drive the implementation, and a lot of it is with cost too. So a lot of it is deciding, should we do the minimum, which I understand is a thing too, or want to go above and beyond that, and then adjust it so your risk strategy and your execution aligns with that. So.
No, those are actually really valid points. I mean, honestly, for anyone that's dealt with us in the past, both us and the Blue Orange teams, I think the synergy here is really strong because none of us want to sell or position things that are not in your best interest. It doesn't benefit anyone. It doesn't. So our job is to really try and identify what's going to best provide you things that meet your objectives. So again, part of what we can do here is work to try and develop stronger cyber resilience. That's really another thing we need to be aimed on. It's not just how do we avoid the attacks? The attacks are inevitable. How do we build our systems to be able to weather the storm or fare that particular attack? That's not just our IT, that's our OT, our cloud, and our mobile systems.
A lot of times when we look at or think about cyber resilience, we tend to think about fault tolerance and building tolerant systems to where if there is a failure, but we have to think about resilience from a attack tolerance perspective and looking at your business continuity and business impact analysis and selecting the correct control framework can assist with that. It also opens up and has you to look at areas that if you're just following HIPAA guidelines, then you may not have even evaluated.
Right, because there's a lot more to your environment than just HIPAA concerns. There's other data in your environment that isn't involved with HIPAA. So, and you start to see this as you get into more advanced frameworks. We could even have conversations about NIST 800-171, where we start talking about controlled unclassified information, or CUI. Right? That's information that may not necessarily be sensitive in nature in terms of releasing information about a particular individual, but it is information that may be damaging to the organization if it was discovered or leaked. So again, some of the other benefits we can talk about when trying to adopt a more robust or a more enhanced framework is really driving the mindset around cybersecurity and providing tools to help promote that improvement by focusing on just the specific functions. A lot of times we walk into an organization and everyone gets so overtaxed mentally when we start talking about how do we improve your cybersecurity or your cyber resilience, because everyone tries to use the euphemism, boil the ocean. There are things that we can do to try and break this down into manageable domains or manageable tasks that individuals can focus on in their day-to-day work that would really help make it much more relevant to those departments and help drive that mindset across the organization. Do they need to know about everything in your organization and how to secure everything? No. They only need to worry about the things that are germane to their particular sphere of influence. Obviously, the whole idea behind this is we want to improve threat protection by going to more enhanced standards, driving that across our organization and spreading it out so that it's a culture really does, by default, improve threat protection because now it's on the top of mind for everyone. It also helps develop internal procedures, help identify, contain risks, may even help you contain potential outbreaks. So it depends on how granular you want to make your procedures. That's one of the reasons why we suggest bringing in a professional. And I'm sorry, I don't want to sound sales-ish. I can do that later, but the reality is, regardless of whether it's us or not, this is something that really is important for you to be able to try and help make things run smoothly, and as a result, help contain things that may otherwise cause you more widespread issues. Helps improve regulator preparedness. Obviously, by virtue of us having a defined set of processes and procedures where things are actually being controlled at a much more granular level, it really does allow you to focus on, yep, here's the findings from our last assessment or the last time we had a regulator in our environment, and we now know that these are covered via this domain. Also helps identify. Oh yeah, go ahead.
Yeah, the other thing about that, if there is regulatory scrutiny, if there's a incident, et cetera, they're going to want to see that you're doing everything you're supposed to be doing, and nobody's perfect. So there's always things to do, making progress. Don't have unlimited budget, so you can't do it all at once, and other things will pop in and fall off. So demonstrating that you're looking at these issues and these items that need remediation, and you're at least strategizing as far as this thing's easy. We'll do that now. This other thing we don't have the budget for, we're going to do it in Q3. Those types of decisions showing that you're managing it is another key thing that will be looked at. So doing assessments year over year, same things on the list year over year is an issue. So that's another thing to show that you're taking this seriously and you're making whatever progress you can in a managed way. So that's the only thing about the regulator piece.
Yes, it shows that you're doing your due diligence, right? That you are doing what is expected. That is what is expected, is that you are doing due diligence, and that what due diligence means is that you're making decisions that any reasonable person would make if they were put in that same scenario.
Right. And this helps you quantify the things that you are doing, so you can justify, yes, these are reasonable ahead of time rather than looking at them in the rearview mirror. More importantly, helps you move away from becoming being the easy target. It's not a matter of, can a hacker get into our environment? They can get in anywhere they want. It's a matter of how persistent they are and how aggressive they are. What we want to do is we want to make it harder for them to get into our environments and make it easier for them to move somewhere else. I hate to sound cynical, but ultimately our job is to make it easier for ne'er-do-wells to break into the facility down the road rather than us. That's all we can do, is control what we have influence over. Lastly, things may even help reduce cyber insurance costs. And I don't say that lightly, because we do actually have a customer that has specifically talked to us about how their premiums have gone down because of the work that they've done to reduce their risk. This is the part where I will sound a little salesy for a minute. If you have an inkling, or if you do want to get us involved, please let us help. The synergies that we have with the new combination of our existing resources and the Blue-Orange compliance team are crazy. It's really exciting for us to be able to bring some of these folks to bear, because it really rounds out our portfolio. So now, as you can see from this whole list, we have the ability to do pretty much everything from the assessments to the pen testing, all the way down to remediation services, virtual CISO if you don't have one. Those are things that we have the ability to do. So not only, as Johnathan would like to say, not only do we tell you what's broken, but we'll also be willing to help you fix it. Have the bandwidth and the resources to do that. We also have managed security services. So should you decide you can't go this alone, we could actually be a partner to help with that. And again, because we'll already be familiar with your environment, that could help us tailor services to better meet your needs, objectives, and most importantly, everybody's budget's always a concern. And we can also help prep for audits and provide additional training services as well. I tried to keep this as brief as possible. So Johnathan or John, do you have anything else you'd like to add?
Not right now, thanks.
Same, not right now.
I want to thank everybody for your time. And for those who are interested, obviously let us know. Any one of us are more than happy. Anytime you've reached out to CloudWave, we become a part of your environment, a part of your ecosphere, if you will. So reach out to us if you think there might be something that we can help with. But also, for those who I did say there was going to be a list at the end, this is just a recent list that I went through and just quickly put together of recent OCR and CMP fines for just healthcare organizations from November of last year to current. Now, these are just the fines. This doesn't include legal fees. This doesn't include any other civil or other lawsuits. It's just the fines that were levied against those organizations.
So Clay, at this point, I think it makes sense to open it up for questions. If anybody has any, please raise your hand or you can enter it in the meeting chat and we'll address it.
I cure insomnia, I know it.
And while we're waiting for people to ask some questions, there was something that you and I were chatting about earlier, talking about capitalizing cybersecurity upgrades, get to the next level. Do you want to expand on that a little bit for the audience?
Yeah, there may be some ways you can actually work to try and capitalize some of the investments you make by actually bringing in individuals or outside organizations to improve your current cyber footprint or hygiene. So it was something that had been brought to our attention several times, but if you want to have a conversation, we can certainly do that, because anytime you're making a change, specifically an improvement in your environment, that is a one-time hit. There are rules around that that would allow you to potentially capitalize that as well. By all means.
All right. I don't see any questions in the chat. So I'll just kind of give it a last call for questions. We will follow up for everybody that registered and attended this webinar. We'll send a PDF copy of the presentation and a link to the recording, so you can have that to refer back to. I will also drop the link for those who are not currently a member of our Cybersecurity Insider program. Webinars like these are offered on a quarterly basis. It's educational in nature, and we also publish a monthly newsletter and provide alerts for cybersecurity warnings and things like that. I will drop the link in the chat and you can sign up. I know that most of the people that are on this call currently are members of the Cybersecurity Insider program, but I know that the links get forwarded and we have invited others to this. So if that's of interest, we encourage you to join us. We are happy to share information and intelligence.
Hello, I'm sorry, I had a little trouble with my mic, Christine. I do have a question.
Great.
What kind of thoughts do you have about when you're bringing on individual physician practices that have all different systems and that kind of a thing? And of course, you'd be moving towards consolidation of security and IT platform, but what are your thoughts about managing cybersecurity when you're in that process of acquiring individual practices?
That's actually a fantastic question. I mean, we actually have, well, we go through it as well, right? So we're in the same position. We're in the process right now of merging with the folks over at the Blue Orange Compliance Group. Well, you want to talk about putting a bunch of compliance nerds, into a process. That's a fun one to watch. But the reality is we can certainly help provide guidance on how to do that. Obviously, as you're bringing in these entities, you need to have appropriate safeguards in place, especially if you're planning on combining systems. So you may be better off treating them in some cases as a contract individual or contracted site until you actually get ready to fully integrate them into your environment, if you even plan to integrate them into your environment. So John or Johnathan, would either of you guys?
I would say involve IT early.
Yes.
And, I came from a hospital, so it was not uncommon for these systems to be acquired and IT find out after the fact. If you're able to get IT in up front and then do a security assessment, and what you're going to be looking for with that security assessment is to be able to identify the risks and then document where those risks are, contrary or there'd be exceptions to your current policy. So the first thing you want to do is get an understanding and assessment of where everything is, and document that to create your program to move forward. John, I know you had some comments as well.
Yeah, I mean, especially, what the integration plan is, and maybe if you're letting it, sit there for, year, months, et cetera, you definitely want to do assessment, determine, deal with the high risk items, and then from an integration plan, maybe it's moving on to one system, or maybe that's going to be a new system. So depending on how you're going to work with it. And in the due diligence, I would think that you've done some work on their security profile and if they've done assessments and things like that as part of the acquisition strategy. So leveraging that work that's done as well, and then plus, as once the deal is done, they're kind of your responsibility. So you want to make sure that you're treating them like the rest of your organization.
Well, I really appreciate what you guys have been doing educationally. I really, really do. I have been on almost all of these webinars the last couple of years. And I would imagine these physician practices, oh my goodness, it probably won't, probably the IT security, wow. I'm guessing it might be non-existent kind of, but we'll see.
Well, and again, one of the things that everyone that knows me will tell you, I can be a little weird. And one of the reasons why is because I don't mind getting involved in situations where there may be some learning tension, as I like to call it, where you're in the process of, well, yeah. It's true, right? You're in the process of acquiring or onboarding these practices. They don't want someone from your organization coming in and telling them what they did wrong, right? Or what they don't do right. So bring in an outsider. Bring in someone where you can go ahead and deflect and say, yeah, you know what? These guys are great, but they tend to be a little over the top, right? It helps you to form a bonding relationship at that point, and yet allows you to get the information from us or, through us that you need to help try and put these organizations together. Great comments, great questions. Anybody else? Once. Right. Well, by all means, if you don't want to or are not comfortable speaking up, that's fine. Feel free to reach out to anyone on your CloudWave team or anyone that who services any of your accounts. Will be more than happy to have a conversation with you about what appropriate areas there may be to start, how we can potentially help with some of your initiatives. Talk doesn't cost anything, so please feel free. But thank you everyone for your time. I really appreciate you hanging with me this whole time. And yeah, can't wait to do it again. Let's chat again.
All right. Thank you, Clay, John, and Johnathan. We appreciate it. Thank everybody for taking the time out of their afternoon. We'll follow up with the copy of the presentation. Thank you so much.
Thanks
all.
Thank you, everyone.
Bye now.
Bye.